We're moving out of North Carolina now. We're moving across the state line to South Carolina, and we're going to hear from Cheryl Sievers Cail, who is the South Carolina Indian Affairs Commission and the South Carolina Idle No More. She's a small business owner in Myrtle Beach, South Carolina, the vice chair of the Waccamaw Indian People, and the chairperson for South Carolina Idle No More, a committee within the South Carolina Indian Affairs Commission. She received associate degrees from Horry Georgetown Technical College in both legal studies and human services, and was a recipient of the Phi Theta Kappa Society's All-State Academic Team Award. In December 2018, after Cheryl's 20-year-old son was diagnosed with testicular cancer, she became aware of PFAS contamination in the groundwater at the former Myrtle Beach Air Force Base, and later learned of the extent of contamination from the use of AFFF at other DoD sites throughout the state. She joined the National PFAS Contamination Coalition in 2019 and is currently working to raise awareness of the impact of PFAS contamination to both the environment and to people within the state of South Carolina. Cheryl?
Yes, good afternoon. First, I'd like to express my appreciation for the work that the National Academy Committee has done to organize the town hall, and also for the opportunity to be able to share how PFAS contamination has impacted our communities. So it was not my plan to be here today. I want to say that right up front. I absolutely did not ever anticipate becoming an advocate for anything of this caliber. I was totally shocked that this has been occurring, and for the enormous amount of time that it's been occurring and nothing meaningful has been done. But I would like to share a little bit about how I became involved. So in early 2018, I was appointed as the chairperson for South Carolina Idle No More. I had been active regarding issues that impact sources of water because of the phrase Mini Wachoni, which is water is life. And it's not just a phrase, it's really a way of understanding the sacredness of our resources. So I had established a strategic action plan to coordinate collaboration with river keepers and tribal leaders within the state of South Carolina. And as Native Americans, we often were left out of the conversation without having a seat at the table. But the goals of protecting the water were shown to be the same for us as for river keepers. And as water protectors, I believe that would be a good collaboration. So I began learning more about water-related issues after Hurricane Florence, and that came in the fall of 2018. With that hurricane, we actually, in this area, had minor damage, but the tremendous impact from the hurricane came from the flooding and the industrial waste, coal ash, among other things. So as I say this, I'd like to share that one of the things I learned in this process is where I live in Myrtle Beach, although there is a border that is an imaginary line between South Carolina and North Carolina, we share a river basin, the PD River Basin, that is shared between the states of North Carolina and South Carolina. So water as a source, it's a vein, it doesn't stop. It doesn't stop at imaginary lines. One of the things from the flooding is that what was coming in from North Carolina, I believe, had a tremendous impact on especially Horry County. We had the Army Corps of Engineers setting up blockades to try to keep the water from continuing on to further impact the Waccamaw River. And I just thought that was really interesting that there seemed to be this, it was more than just about the flooding and the impact, but about the waste that was going to be traveling into the water resources. So where I live in Myrtle Beach, the flooding had literally isolated our community for weeks. We were an island. So we were just literally surrounded by flooding. So at the end of 2018, just after the first roundtable that I organized with Catawba River Keepers and leaders from Catawba Nation, my 20-year-old son, Trevor, was diagnosed with testicular cancer. And if I can, I would like to share a photo. Let's see if I can get this up here. I'd like to share that photo. I don't know if you can see that.
We see it.
That is just prior to his diagnosis. So we had seen this unusual, what looked like a dermatological issue that just came up within just a matter of a couple of months. And it was alarming, to say the least. This was just on his back, on his shoulders, on his neck, and not what I would say was an issue that you would think, okay, he's having testosterone, something. So, of course, it was to go to a doctor to try and figure out what was going on. Had there been an awareness at that point in time that there were environmental contaminations, had the doctor maybe asked a few more questions, where are you working? Where are you attending culinary arts school? Maybe, just maybe, there would have been more prompt attention paid and action taken to address what was going on, because he was diagnosed with testicular cancer. It took 9 months for that diagnosis to actually happen. And in the meantime, that cancer had overtaken his testicle and additionally had moved into his lymph nodes. So he was, as I said, working in a restaurant and attending culinary arts school. And the location of that was at the former Myrtle Beach Air Force Base. Still not putting any pieces of this together. Of course, not having any knowledge that anything, that there should be any cause of concern. We did, however, throughout the course of his treatment, and I say it's ironically, we spent a lot of time watching movies and documentaries, and it was during a time when we watched the documentary, The Devil We Know, and this caused him to look at me, and then he wanted to find out, well, is that maybe why I have cancer? And I'd imagine a 20-year-old trying to understand why he had cancer. And that was what later, short time later, he came to me and said, Mom, you need to see this. He had found the Environmental Working Group website with an interactive map showing the locations of PFAS contamination. And the former Myrtle Beach Air Force Base was listed as one of the DoD sites, with contamination in the groundwater totaling 2,640,000 parts per trillion as of 2019. So I did further research and discovered that the former Myrtle Beach Air Force Base was listed under the EPA Superfund program and had been on the national priorities list during the base closure. And it was later deferred to the state and a corrective action program under RCRA. Cleanup activities continue now with monitoring the facility, treating the groundwater, and cleaning up contaminated soil and sediment. So all is well, right? No. What I didn't understand was, how could it be that this site, which is now Market Commons, a fully developed community with hundreds of homes, shops, restaurants, parks, and schools, still could be a source of high contamination from PFAS? And additionally, was this the cause of my son's testicular cancer? So as I became more aware of the PFAS communities working towards raising awareness and demanding solutions, I also became aware of the serious lack of conversation and action here in South Carolina. As I like to say, we are Johnny come lately. It wasn't until a private testing for PFAS of wells located in 3 communities next to Shaw Air Force Base that the issues seemed to be coming to the forefront. And then I finally saw information about PFAS contamination being provided on the state's DHEC website. And it wasn't until the early part of 2020 and just before the pandemic that DHEC began to take further action. And later in the summer, during the pandemic, began testing of the water. So again, how could it be nearly a decade since PFAS legacy chemicals were known to have health impacts before appropriate action was taken? So I've seen this many times before doing historical research. It is what I call the way of wealth before health. What happened for us will happen again for others if not addressed. And that is we began on this journey. We were trying to find answers among the medical community. Surely doctors would know what to do. That was my thinking. So how to go about testing, to get answers, and for what to do next. and instead were met with quizzical looks as though we should have the answers. And what was discovered is that a physician, one who should be aware of PFAS as a health-related environmental issue, had no knowledge of the effects linked to the PFAS contamination, no knowledge of the PFAS contamination. So an oncologist treating people every day for cancers such as prostate, kidney, testicular cancer was not only not able to offer guidance, but simply didn't have any knowledge at all. And I do credit my son with attempting to educate him. So we had to search out to try and find a source for testing and then for relaying that information to his physician. And to say it was frustrating is an understatement. So because we are not in an impacted community based on the data, which is simply nil at this point, the lack of available options for testing was limited to those who have had work-related exposure, such as firefighters, and made the test inconclusive. And this left my son with a sense of defeat. But for me, it just simply identified another problem to be resolved. Access to testing for community members who have medical diagnosis linked to PFAS contamination, but not related to industrial work-related exposure. So this is what I'm asking for the National Academy of Science and Environmental Medicine to address, to help establish PFAS contamination as a significant environmental health issue, to educate those working in the medical community by establishing testing and treatment protocols for those in impacted communities, and for those who have diagnosis of known diseases that have been linked to PFAS contamination, begin a collection process that is meaningful and data-driven to detect what the true impact of PFAS has been in order to identify what steps should be taken to provide health-related services, including monitoring for our children now. And what issues are being experienced in my community, what are the concerns, and that is why I'm here. My community is only beginning to have knowledge of the PFAS contamination, but there's no doubt that over the last decades, we've seen a dramatic increase in cancers, autoimmune disorders, fertility, birth-related defects. So this statement, and I'll finish on this, this statement was from a local family practice physician who I met with last night doing 4 signings, who's been treating thousands of people in my community for nearly 20 years. And his take on this issue is simply that physicians need a protocol, much like the protocol for lead poisoning. It is a nationwide issue, and so is PFAS poisoning. Thank you. And I'd like to thank you again for doing this and hearing our stories. And I trust that you folks at the National Academies will move forward and take further action in order to address the issues presented today.
Well, Cheryl, thank you very much. And again, I think the willingness of you and others to be sharing your personal stories is very, very impactful.